Yeah, yeah, yeah. Yeah. It's percolating. Good morning. Yeah. Good morning to the people on Facebook. Good morning to the people on IG. Good morning to the people on the YouTube. Good morning to the people on LinkedIn and Twitter too. Java. Percolating. Get a vibe, stay ready. Truth in the cup, keep it strong, keep it steady. Pull up a chair, yeah. Take a sip with me. Good morning, good people. Java with Jimmy. Good morning. Good morning. Yeah, the love percolating. Java with Jimmy. Good morning. Good morning. Yeah, yeah, yeah. Good morning. Yeah, the love percolating. Yeah, Java with Jimmy. Good morning. Percolating. Yeah, we in it. Yeah, we in it. Good morning. Good morning. Java with Jimmy. Percolating. Yeah, we in it. Yeah, we in it. Good morning. Good morning. Java with Jimmy.
Good morning. Welcome to the Java Cafe, Java fam.
Oh, there we go. Good morning, everybody. Good morning. Good morning. Today is, let me get it right because I messed up yesterday. Tuesday, March 10th, 2026. And I should remember that date because we are intentional with our partner today. ABCD, Action for Boston Community Development Health Services, is with us with one of their partners this morning, and also a consumer, an advocate in the space of HIV. Today is nationally known as Women and Girls HIV Awareness Day. And as it is Women's History Month, we thought it was so apropos to have this conversation for our women and girls. But let me correct that. It's about our women and girls, but it's not just for our women and girls. So as I am welcoming you this morning into the Java Cafe, I'm going to ask you to do me a huge favor, and I do it just about daily, but we do share very important information resources daily. So please do me a favor and hit that share button and like and invite somebody into the Java Cafe that needs to learn more about where we are with HIV prevention, treatment, and also we'll have a little conversation if there's still a stigma. And we'll also talk about very appropriate for Women's History Month is the different impact that it has on women and girls. So again, do me a favor, hit that like and share button and invite others into the Java Cafe. I am getting ready to bring in my co-host when we partner with ABCD Health Services, Maureen Scott, who is a clinician and also the director of ABCD Health Services. And so we're going to bring her in. She's going to introduce our guest today, and we'll get right into the conversation. But again, please do me a favor and hit that share button and invite others in to be a part of this conversation. Maureen.
Hi, good morning. Good morning.
I like them. They're blue, so we'll give them a pass, but your earrings are wonderful.
Thank you. These are my favorite. People know these earrings very well. I try not to wear them all the time, but they really look nice with black and white. So,
well, I haven't seen them, and you've been here quite often. You are my co-host in this space with ABCD Health Services. So please greet the audience. You all say hello to Maureen as well while you're hitting that share button. And Maureen, just tell us about a little bit about Affinity Days, and specifically this one as it pertains to raising awareness in Women's History Month around women and girls HIV awareness.
Well, good morning, everyone, and thank you, Jimmy, for having us again. Today, we are honoring National Women and Girls HIV Awareness Day. You know, we come together as a community to talk about these issues that continue to impact women and girls and the families around them in very real ways. HIV affects our families, our neighbors, our loved ones, and many women still face barriers like stigma, limited access to care, lack of resources that make prevention and treatment harder to reach. Conversations like we're about to have replace the fear with knowledge and break the silence with support and remind every woman and girl that her health and her future matter. The theme this year for National Women and Girls HIV Awareness Day is Hope, Health, and Healing. Overcome barriers to HIV treatment for women and girls. To guide us in this important conversation, we are honored to be joined by two distinguished guests. The first we welcome is Deb Winters. Deb is currently the clinical director for Massachusetts for the New England AIDS Education and Training Center, also called NETIC. She's the co-clinical director for New England Region and assistant professor at UMass Chan Medical School. Her work includes training and clinical mentoring for nurses and healthcare workers at community health centers with a focus on the need to increase screening initiation of PrEP for women, adolescents, and young adults. Another focus is the growing number of people living with and aging with HIV disease. Awareness and training that includes clinical information about the virus, medication options, and the psychological effects of living long-term with HIV is needed for healthcare workers providing home care, working in extended care facilities and nursing homes. So let's welcome Deborah. We also have here today is Kimberly Wilson. I'm not sure if she's on yet, but I'm going to introduce her. We're pleased to welcome Kimberly Wilson. Kim is an accomplished community advocate whose work is guided by principles of equity, service, and lived experience. Her dedication focuses on making sure women, particularly those affected by HIV, are fully engaged in research, policy creation, and decision-making activities. She lives by the belief that when women are not present at the table, there is no table, highlighting her steadfast dedication to representation and accountability. Her experience in the field has contributed to her professional development and effectiveness as an advocate, an educator, a leader for systemic change, particularly as a woman living with HIV. She currently serves as the chair-elect at the Boston EMA Ryan White Planning Council, where she champions fair, community-driven, let me just get it back here. I'm so sorry. Where she champions fair, community-driven HIV services and improve health outcomes. Kim co-chairs at the Fenway Health HIV Consumer Advisory Board and serves on multiple state HIV advocacy committees. There is so much more, but I'm giving you guys just a little bit of each one.
I think it's important, and you know this space, Maureen, our audience, and they'll tell a little bit of this story, a couple of seconds about it, and we know this as people get to know our guests, it's easier to receive the information that they're sharing. And so I think it's important to talk about both of their professional work and also experience in the space. So without further ado, Maureen, we're going to let you go in a couple of seconds, but I would like to welcome Deb Winters into the Java Cafe. And let's just note, she's wearing this wonderful red sweater. And also Kim Wilson as well, who I had the honor of, I've seen her in community before, but we talked a few weeks ago at the Cry event. So I'm glad to have both of you here with us. Maureen, so thank you for making the introduction and level setting as you always do. And we'll talk soon.
All right. Thank you, ladies. Bye-bye.
Deb and Kim, welcome to the Java Cafe. Kim, who knew it would be this quick? I said something to you about connecting, and then when I seen your name in Lee's email, I said, yes, we do definitely have to hear. So Deb, welcome to the Java Cafe, Kim as well. And I'm just going to go on order of my screen. Deb, if you could say good morning to the audience, and I would ask you, after your greeting, if you could just give us, by your experience, one word for the state of women and girls HIV awareness, one word that just describes where you think we are in whatever context you would like.
Good morning, Jimmy. This is an honor, a real honor for me to be on your program. I didn't know about you before Maureen introduced your podcast, and I've watched several of your viewings, and it's just excellent. And we need more of you. So thank you so much for what you're doing. For me, that one word, progress. I want to say progress, and I'm with a question mark, because it is again one of my focus areas, in particular because I have seen from the beginning what HIV can do, and now that we have prevention, I'm hoping that progress is going to be our word.
And I'm so glad to hear that, especially in this space when, Maureen mentioned stigma. I remember coming up in my, I believe, teen years when HIV, first came on the scene. And so I'm glad to hear that word progress. Kim, I'm going to ask you to do the same thing if you don't mind. Greet the audience, say hello, and then give us your word for where you believe things are in reference to whatever context you would like to share when it comes to women and girls and HIV awareness.
Well, good morning, Jimmy. And I had a feeling. I said, that man looks familiar. I think we're making progress. I think that we're making progress as women and girls, but we still have a lot more to go. We're breaking down barriers that have been up in the past, but I just think that we still have a long way to go with making ladies feel comfortable, making ladies know that this is real. This is our life.
Absolutely. And so we're gonna go ahead. I'm sorry.
Women and girls, I think that a lot of ladies, because we have other things in our life, that's something they don't think about, taking care of themselves first. So when they get infected with HIV, it's just another thing in their toolbox that they have to worry about, but still being the main things: family, relationships, working, providing for the family, and everything is still their main concern.
And we know that it's a conditioning thing, it's a societal thing, but there's a lot of tradition.
I can't hear you.
I'm not sure what's going on.
I can't hear him.
We have often a lot of times where it's believed that women are the caregivers and things, and there's just, so as Kim said, there's so much to add to the toolbox. Let me see if we got Kim. Did you can, okay,
yeah,
awesome.
I can hear you now.
Awesome. And so just adding that, as Kim said, is just another thing that our ladies, and I love how you said it, Kim, ladies, because it is our women and girls, and it is important to make sure that there are safe spaces. And so this is one of the spaces where we share information. And so, I'm 54. And so when I was looking at our notes to get ready for today, I really said, hey, we may need to really remind this generation and folks of what HIV is. Because of PrEP and treatment, there used to be a whole cocktail, and now folks can do, one pill to get and remain undetectable. But Deb, if you can, for us, can you level set and just remind us what HIV actually is?
Yeah, so it's a virus. It's a virus that attacks our system that keeps us healthy. So when we get the flu, when we get, a cold, whatever, our body's immune system, they take care of that and get us better. Sometimes we need medication, whatever. But this virus is very special. It's very different. So it's a virus that attacks the immune system, and it just keeps reproducing itself over and over and over again. Difference between, and I still get this question, between HIV and AIDS, or when we're telling someone that they are newly diagnosed, with HIV, oh, I have AIDS. Well, AIDS is the result of the virus. That's the infections that happen. So HIV, the virus itself, can be in someone's body and will be for life, but no one, necessarily is going to develop the infections that lead to that diagnosis of AIDS, because we have medication. So yes, it is something that is not curable, but the medications we have right now, someone can live a normal, healthy life. That is also to make sure that the diabetes, the heart disease, the smoking, all of those things are taken under control. But versus when I started in 1986, where there was no medication, or very little medication to be able to tell someone that they could live a normal life, today it's much different. So it is a virus. Don't necessarily have to be developing the infections that lead to AIDS, and it is for life, but there is medication for it. So thank you for that question, because I still get that question from many patients.
I thought it was important to, just inform that. And so, Deb, I like how you said that it's not, I will just say this. When you mentioned 86, I was 15 years old. I remember being an early teen and hearing about this. And at that time, a diagnosis was a perception of death. And a lot of things have changed and treatment has changed. And Kim, I would like to ask you here, and Maureen, alluded to it, and I've seen you speak on panels. And so where, things have changed and people are living, and I struggle with that term, quote unquote, normal life, because of a lot of the, stigma that's attached to HIV. And so Deb, thank you for saying that. And Kim, if I can ask you to just share what Deb said as a demonstration that it's not what it used to be, and people are living healthy, holistic. To Deb's point, I think folks are paying more attention now to, if you do get an HIV diagnosis, you do have to pay a little more attention to other things, social determinants of health and things like that. So I'll shut up. Kim, can you just tell us about, the experience of women living with HIV?
Women nowadays, we're living full lives. With their mothers, there's ladies who are in a professional. It's not decrepit, not making us say, "Oh, we got to stay in the bed. We're gonna be small." I have to laugh in my personal life. Somebody said to me, "Oh, but you can't be a woman with HIV. You're healthy. You're big. You run around. You're on clubs. You work a 9-to-5 job. You help do other things in the community. We're living a full life like everybody else. Yes, we take medicine." Yes, we're more conscious of our health, and sometimes, in situations you're like, I don't think I'm going to do that because it might be like not the most healthiest situation. But we have doctors. I know ladies who are lawyers, myself, like a case manager, daycare providers, home health aid, just tons of jobs that people would have said, oh, you can't do because, oh, you're going to be sick, because we don't see ourselves as being sick. We just have another disease like anybody else does. Yeah, there is some things that we have to, I'm not going to go out there and, do something that's going to make me cut and give my, have transmission of my blood or anything to somebody else, because, hey, we know that, hey, in my blood, there is this disease. But in general, we live our lives. I always say, a friend of mine who found out that I was HIV positive looked at me. She goes, "That's impossible. You're not small. You're not, you don't run the doctors. You go everywhere." I said, "I'm living my life to the best, to the fullest, and plus on,
I love that. And I think Deb is shaking her head as well. And I'm not sure if you two actually, I presume you two know each other from working, from working in this space. But I love how you said a full life, you know what I mean? And doing everything. And let's just name, I was a little offended, when you said that some people said to you, "Oh, you don't have HIV because you're big." How dare they? That is just so, that's not right.
Well, I just lost 50 pounds, and a friend of mine went, "Oh, is it because of your HIV?" I said, "No, because I'm fat." Okay. And I wanted to lose 50 pounds, and I am too cute now. And I said, wait till I lose my next 20 December. You ain't going to be able to handle me. Okay. Handle me. And I felt bad because the first thing they said was, "Oh, it's because of your HIV." And I went, no, girlfriend. Okay. This girl is getting smaller because she won't look too cute.
You getting ready for prom season?
I'm ready for bathing suit season. Hello, you all wait.
I love it. And I just want to name, the joy there. And we're not going to talk about like the mental health impact now, but maybe, come back at some point, Kim, and talk about that, because and I heard your story, presumably where you are now may have not been where you were when you got the diagnosis. And so we can definitely talk about that again. But Kim, can you level set for me? And then we're going to talk about transmission, because there, early on, it was the gay man's disease. Speed things up. Deb, you remember this? A large number, and Kim, I'm sure you remember this. There was a period where Black women were a large percentage of new diagnosis. And so where are we with the disproportionate impact, Kim? Can you just level set there for us?
We still are one of the highest proportions of people that get HIV. You know, it hasn't changed, but it's decreased. It's decreased a great deal over the last couple years. You know what I mean? And I think it's going to continue because as sisters, we are teaching each other, we're supporting each other more. You know, but we are high. We're one of the highest populations that are affected with HIV.
And can you tell me, Kim, you know, there's different ways of transmission. You mentioned not maybe pursuing a job where there's risk of being cut or bodily fluids. I'm going back to my health educator days. Bodily fluids. And so can you talk about a couple of ways of transmission that this happens?
You can get it by transmission of bodily fluids, sex. You know, sex. You know, anal sex is one of the biggest ways to get it because, you know, the area of your body is very thin. You can get it through blood, you know, sharing needles. Ladies who don't know they're HIV positive can give it carry it from themselves to their future child. You know,
can I also chime in on one thing? Because Deb, I said this, and we're going to come to you in a minute, Deb. Thank you for being patient. But when you said about women can transmit it to men.
Yes.
As well, because I said in my post about this, that this isn't just for women and girls. This is for men too, because they need to be aware. They have daughters. And Deb, we're going to get into this. They have daughters, they have sisters, and they have mothers. And that's a topic we'll get into in a few minutes about our seniors. And so, Deb, if you could just finish out ways of transmission, and then we'll check in with Deb.
No, Kim actually mentioned pretty much all of them. You know, it's the fact of having unprotected sex with someone who potentially is HIV infected. Male to female, female to male, can transmit the virus. The good news is actually if someone is HIV infected and on medication and has a partner who is not HIV infected, that person will not transmit the virus. So that is something new. That is progress that we have made in 2026. So again, if someone is HIV infected, they are on their medication, their virus is under control, and they have a partner who is not HIV infected, they will not transmit that virus as long as they remain on the medication. So that has become just a real a game changer as far as progress.
And thank you for mentioning that, because when we talk about transmission, we talk about often that, but I'm an old head. So transmission is often pointing to not getting it. But now there are ways that transmission is actually, and the term that you're talking about can be surmised into one word, as undetectable.
Right. Equals untransmissible.
You equals you.
You equals you. And so, Kim, put you on the spot, but presumably you're undetectable.
I am undetectable.
May I ask you, for how many years have you been undetectable?
17 years.
17 years. Deb is just with me.
17 years.
It reaffirms what you said about the fact that it's not a death sentence like it was when you got diagnosis, you know, decades ago. I'm 54. Oh, Jesus. 40 years. Did Deb mention 80?
40 years, Jimmy, 40 years I'm doing this. I mean, I'm a nurse 53 years, but 40 years I've been doing HIV.
Where'd you start nursing at the birth?
You are so.
Yeah, she did.
Good thing we're not in person, because I'd give you a hug.
I would love that if we were. I would receive that hug. And so, to both of your points, you mentioned progress. We just talked about undetectable means untransmittable. You can't transmit it. Deb, you said your word was progress. Let's talk about the progress in the last couple of years of what happened, and then we'll come back to Kim in just a couple of seconds.
Progress with the treatment, Jimmy, or
progress however you want to frame it. Progress with the treatment,
right?
Even diagnosis with prevention,
right?
Though some populations are increasing, generally Has there been progress with less diagnosis? And then anything else you would like to point to as a clinician?
Yeah, so certainly, again, 1986 when I started, I was, burying about 10 to 12 patients per week in a private practice in New Jersey, in actually Princeton, where there was no HIV, quote unquote, but part of the original clinical trials. So over the years, what I have seen is the treatment of HIV, as we discussed just before, and then I never ever thought I would see in my day prevention of HIV disease. So the progress has been not only in treatment, but in prevention as well. But we still have new infections. So, here in Massachusetts, I don't know if you want me to kind of talk about that in particular, but, we had in 2024 about 500 new infections. And, for females, that was about 27% of those, which is about 6,000 women, new infections. So the problem that I'm seeing now is over the last 10 years or so, we've seen in the US about 30,000 new infections every year. That number should have gone down. So progress in
Mhm.
our treatment and
Mhm.
prevention, but we still have new infections. So I should be out of a job by now, Jimmy, after 40 years,
Yeah.
and I'm not.
So
Mhm.
let me ask you this, Deb, and Kim, you can chime in here, and I'm getting a little off sort of our flow of conversation. I used to be a health educator, so this is taking me back to my teen days. But in that, do you both believe that there was a lull in education because of things like PrEP and people knowing that you can get to an undetectable status, and maybe I don't know if there was a period where diagnosis may have generally went down. You don't hear as much information and education and prevention around specifically HIV like you used to. And so, Deb, if you could answer that, and then Kim, I'll ask
Yeah.
your thoughts on that too.
Yeah, and again, going back 40 years, I was part of the original ACT UP. I was part
Ah.
of the original, all of the, the lobbying that we had done, and the visibility of what we were going through because so many people were dying. Jimmy, you're right. Okay, we don't see it well, and I'll preface that by saying now on the TV, I'm actually seeing ads for prevention of HIV with the new medications that are around. So it's starting to be more in the media. But generally, no, you don't hear about it like we did when all of the actors and actresses had died. Ryan White,
Yep.
the young man who
Mhm.
who died, all of the things that he went through, you don't hear that today. And so one of the things that I'm doing with the clinics and the professionals I'm working with, nurses, is saying, we need to have more visibility. I need to walk into a clinic and have a big sign that says, "Did you know that there's prevention of HIV?" And leave it to somebody walking in saying, "Wow, maybe I'd like to know more about that." So yes, we need to be more visible, Jimmy, because we're not, and that
Mhm.
I,
would be part of the
Mhm.
success of prevention.
and it's lent to the progress as well. And so, Deb, you mentioned about on TV. One of the reasons that we're in partnership with ABCD is entities like ABCD and others have seen the impact of non-traditional media and also having a little deeper roots into community. And so, Kim, if I can ask you, we talked about the disproportionate impact on Black women. I've often said that when America catches a cold, the Black community catches the flu. And so, with that information and education piece, what are your thoughts on, as Deb pointed to, prevention is progressed, treatment has progressed, but new diagnoses is not as progressive? What are your thoughts there?
No, so I'm like Deb. I thought by now we should have like a handful of them. You know what I mean? Each year. And every time I go to meetings, they're saying 500 people. I'm like, where are we missing it? Where are we missing it? I talk at high schools a lot to high school students, and I talk to young adults. And I think that for some reason, a lot of them that, oh, this was a disease back in the 80s and 90s because they could take a pill a day, and there's PrEP out there now that it's okay. It's just a disease. I never forget. I was talking to some young lady, and she goes to me, "I don't understand why you all still hyping this because we can just, if we get it, we just take a pill or two. And you know what? I was told there's a pill, about that can prevent it." And I'm looking at her going, "Really?" And I said, "That's how you all feel about it now, and that's the problem. We have a generation that feels that way. That it's just a pill. Hey, I'm not going to get it. I can take this prep and be good about it. But the problem is that's not the mindset they should have. The mindset they should have is prevention, at all costs. It's not just a pill. I told the young lady, I said, but, and I didn't want to be mean to her. I said, but you took birth control and I love your 3-year-old daughter. And she looked at me and went, oh, and I'm like, yeah, let's be honest. And I said to her, I said, if you had covered up, you might not have your 3-year-old daughter. I said, you know what I mean? I said, you can take your pill, but you never know. Even if you take PrEP, nothing's 100%. And I said, as a woman, you have the empowerment. She's like, oh, well, this guy was with me and da-da-da. No. I said, you swayed to him. He said, hey, let's do this, whatever. No, you have the way. You've got to empower. You've got to take care of yourself. I said, because you know what? Once you get HIV, it is your responsibility for the rest of your life to take care of yourself.
I definitely agree. And I had to almost keel over there when you said that, you were on birth control. And I love
and she was, that's what she told all of us. And I'm sitting there going, and I love her daughter. Don't get me wrong. Her daughter's my little bestie. But I'm like, you have this daughter, I said, nothing is foolproof, And I always tell ladies that, a lot of them say, oh, but he said this. Oh, he said that. I said, no, you have to control the narrative sometime in your life. And if you don't control the narrative, you have to pay for the consequences. I did not control the narrative once in my life. I said, and I'm sitting here with HIV, and I have to be responsible for making sure I take my medicine, I go see my providers. And there's other things, as you said, the mental health, the stigma, and this and that,
I definitely can appreciate your transparency and also driving home the point that, and I'm going back to my health educator days. We didn't have PrEP when I was teaching young people. Oh, no. All we could talk about was the Noxinol 9 not lace, the Noxinol condoms with, what was it? The Noxinol 9 that like, so y'all are laughing because this, I remember the training. I remember. And so, I don't want to get too far off, but I think Maureen or Lee, at some point, we may have to do a part 2 of this and maybe do it after dark and have a real conversation. And so Deb and Kim, let's say that, for whatever reason, this isn't a judgment. Kim, your point about the narrative, it's not a judgment statement. It is a fact. And I will say as a man that it's not just the men, oh, he said he didn't and da-da-da. Some of our sisters are being honest, with some of our men, so it does definitely go both ways. And this is why I said earlier that this is focusing on women and girls, but it's not just for women and girls. And so let's say you do receive a diagnosis for whatever means of transmission. Deb, where are we with treatment? We alluded to, getting to undetectable, but how does one do that? And then Kim will come to you in a more practical way of, taking the pill. We'll talk about what you have to do with treatment away from the clinical pharmaceutical side.
So it's a great question, Jimmy. And what we are focused now on is what we call rapid start. So the goal is I tell someone that they are HIV infected. I provide them the support that they need initially with the message that there is medication that you can start. We would like to start you today, as soon as possible, because the faster we control the virus, the better the long-term outcome. What are those options? 1 pill once a day. Everybody kind of sees that campaign on the television, but we also now have injectable medication, which again, I never thought I'd see. Not only 1 pill once a day, but now we have an injection that someone can take every 2 months. That's amazing. So there are options. The goal being, again, I tell you that you're infected. We get you on medication ASAP, as soon as possible. You become undetectable. And in fact, you will live, and I do say it, there's no reason why you cannot live a normal, quote unquote, life, as long as you are hooked to the hip of a provider. So that is one thing. There's commitment. And I don't care who that is. If it's with me or another provider, you need a relationship. That's one thing that changed nursing, Jimmy, that you need to know about. Prior, I was trained in the 70s, it was the nurse and the patient. There was a barrier, we had to continue this professional relationship. HIV actually completely dissolved that. And so what we have now is long-term relationships. I told someone they were infected in 1986. He contacted me last year. He's still alive. He should not have been, but for some reason, someone up there, he actually has made it through the last 40 years. It's been a long-term relationship. He found me and we actually reminisced about the old days. But that's what it needs to happen, is that people need to continue to be in a relationship with healthcare. And that's also challenging, Jimmy, as you
Mhm.
probably well know.
It is, and we alluded to social determinants of health.
Yep.
We have presumed. I'm sure that there is a population that receives Medicare or Medicaid across the country and in different states. There are the availability of a lot of the prevention and treatment is changing, and so Deb, to your point, healthcare is a equity in healthcare generally is a need, but then don't have. And I don't. Would we classify HIV as a comorbidity?
No, not a
Okay.
comorbidity. Yeah,
Yeah, got you.
yeah, yeah. Um,
Um,
but you
so
bring up an important point because
yes.
again, if someone again, remember what I said in the beginning, this virus needs to be controlled. So
Mhm.
that requires medication.
Mhm.
With all of the stopgaps going on now, the issues regarding Medicaid, Medicare, health insurance, and the fear of coming into a clinic or a pharmacy because of, the immigration status, if someone stops that medication, this virus again is very smart. The
Mhm.
undetectable becomes detectable very quickly.
Quickly.
Okay.
Mhm.
All right. There's so much
Mhm.
here. And as I said, we have to do part two. And what we did was make sure that we got some succinct information out. So we're going to go, we talked about treatment. And then also, if you can, Kim, from what I asked before and now, what are some of the issues that HIV treatment bring up maybe for specifically for women? And we can go on the spectrum of, childbearing age to our seniors. What are some of the issues that we can talk about? Because I'm excited about this information, so I want to keep us, on track. And so, what are the issues for women?
I think one of the issues is a lot of ladies worry about the cost of the medicine nowadays. I've had a lot of ladies come to me saying, "Oh, there's changes to my health insurance. How am I going to get access to it?" Then I explained to them, "Hey, you know what? There is funding for us to the Ryan White program. I mean, we have HDAP, we have different things, different vehicles to get the medicine. I always said personally that making sure I get my medicine is my biggest thing in my life. And it's educating them that, hey, there is funding out there, especially in Massachusetts, to help us get our medicines, to help us get to the care that we need. I think one of the barriers is that they don't want to tell their partner. It's very hard. I mean, to have a conversation with somebody, and say, hey, well, I'm HIV positive and da 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 da. That's one of the biggest barriers.
One of
You know,
the I'm sorry, are there other barriers like are there things that come up around for some of it, and I don't want to get in trouble here, but things come up for women that may be dealing with menopause that maybe they
um,
started treatment be that type of
a
thing
lot
like
of a lot of ladies go into menopause sooner. A lot of us go into menopause sooner because of the medicines we're taking. Like I always laugh at my friends. I think I've been in a perpetual menopause for so long that hot flashes. But we are in the HIV world doing studies to help ladies to see. We just started one recently. And I think that we're blessed that way that they're seeing in the research field that hey, there's other things that happen to ladies that we need to start researching so we can get a better handle on it.
Absolutely. And one of those things, Deb, if I can come to you here, what comes up, I mentioned childbearing age.
Mhm.
Are there things that come up for women? You mentioned, or either you or Kim mentioned that, some have become HIV positive through, birth. Sometimes it's not passed on. So if we can talk specifically about we're talking about women and girls. Let's talk about, are there issues if they want to or become pregnant, either planned?
Hmm. or
Well,
unplanned.
I was struggling. Thank
Yeah,
you, Deb.
no. So again, going back to my 40 years, where the women that were pregnant, actually, transmission to the child was almost a given at that point,
Mhm.
until the medication started to come around. And so now, again, a young lady who I tell who's HIV infected today, in their 20s, early 30s, who said, am I going to be able to have a baby? Absolutely. Again, once we get your virus under control, you can certainly get pregnant and have a baby. The risk of transmission to that baby is less than 1%. Now, we can't say it's never. We can't say that, Jimmy, because it's a virus, but less than 1%. And so what we do with that pregnant woman when she becomes pregnant is we're going to track that virus, make sure it remains undetectable throughout her entire pregnancy.
Mhm.
And the good news, again, from 2 years ago, a woman now can, with a discussion with her provider, be able to breastfeed. For the longest
Mhm.
time, I
Mhm.
during the last 40 years, 16 of those years, I was back and forth to Africa and doing a lot of training with nurses and physicians on HIV disease. And for mothers in particular, they would say, I have to breastfeed. If I don't, my village will throw me out. I'll be ostracized. So there was just a lot of concern. But what we found was once they were on medications, the babies weren't, breastfeeding did not transmit that virus.
Mhm.
So now in the US, we are able to tell women,
Mhm.
yes, you can breastfeed. This is what we're going to talk about. And then make that shared decision with the provider. So it's phenomenal news for a woman who wants to have children.
It goes back to your point that you both said about living a full life. And again,
Mhm.
however people contracted, got diagnosed, however it was transmitted, that should not. Well, yeah, I'm gonna make a value statement. My value statement. So I'll put myself on the screen. That should not stop an individual's ability from living a full, a life and everything they wanted to do before that decision and when they got the diagnosis. And so I think if anything is coming out of today for everybody, but specifically for all women and girls, it is even if for whatever decision or how, it's not a death sentence and you can live the full, as you said, Deb, normal life. We've talked about treatment. We've talked about what it is. Now let's go a little bit deeper. And Kim, I'll start with you here. Deb alluded to it, but what are some of the ways? Now I'm old school. Y'all know the A word that was out there some years ago in order to stop everything: pregnancy, HIV, STIs, emotional trauma. What was that A word back in the day?
Abstinence.
I was
Abstinence.
wait,
Yeah,
I was gonna say
I was gonna say, really? Abstinence. And
abs-
abstinence is something when I talk to students, and people, I say, you know what I mean? That
is,
is your option.
and
That is an option.
is that still the number one way? Can I
Yeah,
alluded to being old
yeah,
school.
it
Is
is.
that old school fact still real?
Yeah, yeah, it is totally real. Abstinence.
And what are some of the other ways? Kim, I'll start with you, and then
I
Deb.
mean, other ways is, as we know, they can use condoms. We teach people that, there's other ways to pleasure your partner without penetrating. I've actually went to I have a acquaintance of mine who is into toys, and other areas. You know what I mean? Talking to your myself, talk to your partner. Go with your partner to the doctors, help them get on PrEP. As a way that you can for prevention.
Absolutely. And then Deb, anything else with PrEP or from a clinical perspective? What is
Yeah. So,
can you just a little bit with PrEP and are some of the same drugs used for PrEP in a pre-diagnosis or non-positive state?
Yeah, there's one of the drugs. I'm correct. One of the drugs in PrEP. I always laugh. It's an HIV medicine. One of the drugs.
So okay, so let's talk about PrEP. What that is as a one of the. So we talked abstinence, we talked barriers, as going back to my health educator days, condoms, and are female condoms still?
Yes.
Mhm.
Yep.
Mhm.
And they're
Yep.
actually very popular with men.
So I'm
Yeah,
not
I
going to
am
get
actually did
started,
a
but
whole big training and became certified in and to teach ladies and men how to use female condoms.
back
Mhm.
in the day, I heard that the female condoms were originally designed for a different population, and
Yes,
because
they were. Yes, they
so we're
were.
not going to. We got to do it after dark.
Yeah. No,
Deb,
they were. You know,
it,
and
it, it,
actually, I am when talking to the gentleman about condoms, I bring one with me and say, hey, and tell them this is what you could do, use it for, and you'd be very amazed. And I've never had it that a man has not taken one, and I'm like, okay, you do you, you know.
that's the no, never mind. In the way of prevention, when you said you do you, I'm not going to turn this into after dark. Deb, let's talk about PrEP and then PEP. PEP
Well,
is the
one other thing too regarding prevention, and something that I focus on all the time when I go into a clinic or if I'm working with nurses, and we're looking at the laboratory results, let's say for syphilis, gonorrhea, chlamydia.
Mm.
Well, someone who has a diagnosis of an STI, sexually transmitted infection, they are much more at higher risk of acquiring HIV. Why? Because HSV, syphilis, gonorrhea, chlamydia, that breaks down the mucosa of the vagina. And in fact, HIV, that's where it loves to kind of, invade in that area that's very not intact. So any STI, anyone who has that diagnosis, we need to make sure that an HIV test is done, and then also to talk about the risk. So, because you have syphilis, gonorrhea, chlamydia, you are a much higher risk for HIV. So let's talk about prevention. Did you know that there is medication that can prevent HIV? And if they say no, would you like to know more about it? They say yes, it's opening up a door of conversation. Because again, and people not understanding, one pill once a day actually can prevent HIV disease, or we now have an injectable medication you can take every other month, and a brand new injectable medication just started last year, 2025, every 6 months.
Yep. Mm-hmm.
So the research, again,
Mm-hmm.
the progress, Jimmy, is just phenomenal. And what we hear, because there was a big conference 2 weeks ago called CROI, it's the conference on opportunistic infections. It looks like that every 6 month injection will be once a year.
Yes.
And the every other month injection may go to every 4 months. So
Ooh.
making it easier for women, men to be able to stay on prevention medication as long as they are engaging in risks that potentially could infect them with HIV.
So this is on the prevention side, and as I heard, and you talk about commercials on the treatment side, is that are there similar progress as you said? Where
Absolutely.
Oh, yeah.
I know there's one now that's you see on the commercials, as you said, you get it every 3 months or so. It has went from the cocktail. What was the number, Deb, that you remember back in the day? The cocktails were as big as what? 8 pills?
Oh, well, the cocktail, it depended actually.
Mhm.
Along with the cocktail, which could have been anywhere from 3 to 8 or 9 pills per day, along with treating the infections. Remember, I talked about the infections
Yes,
that
that
were the
came.
diagnosis of
Oh,
AIDS.
yes, yes,
Some
yes,
of my
yes.
patients, they were on 18 to 22 pills a day.
Mm-hmm.
18 to
Mhm.
22. I have pictures, Jimmy, that I show
Mhm.
staff.
Mm-hmm.
Because again, they don't know, they weren't around when when we had all of these combination medicines that were several times a day
Yep.
and several pills a day. Again, we're down to one pill once a day for treatment, or one pill once a day for
For
prevention,
prevention, and that
or
is
injectables.
or the injectables.
Yeah.
Kim, if I can ask you, just from a prevention standpoint, again, we talked about the condoms. What are some other ways that we can prevent? Have we covered everything? We said abstinence, we said condoms, we said female condoms, we said injectables, we said PrEP. Did we cover PEP? What is the
We didn't
difference?
cover PEP, and also include that, Jimmy, treatment of a sexually transmitted infection. So that's part of prevention.
Treatment.
Yep.
You know what? As
Yeah.
elementary as that is, to hear you frame it, yeah, okay. Yep. It is prevention, because treatment of that,
Mhm.
as you said, may make you want to get tested. And if it comes back
Yep.
negative, then you start
Mhm.
hopefully decreasing high risk behaviors.
Mhm. Mhm.
Okay.
Yep.
You all have really taken me back to my, you remember Check, the Community Health Education Center? I
Yeah,
took
absolutely.
my family
Mm.
planning training right there at ABCD
Hmm.
back in the day when they used to certify us. I just never took.
Wow.
I'm,
You're
I'm,
going back
I'm
now.
I Yeah, I told you I'm 54. All right. Kim, what are some other ways as we get ready to wrap up? We are definitely going to share
I mean, I think
resources
that
and links.
we've kind of covered most of them. I think that education, I think that's the main thing, getting the word out there to the public, to the people about education, and telling people that like stuff like prep, you know, it's educating. Once the way that we put it out initially, a lot of people thought, and I know I've talked to a lot of ladies about it, that it's just it's something for the males. You know what I mean? It's for males, primarily gay males. But getting the word out there that no, it's for people. Period. That this medicine is out there for people. Period, and educating people. And that's the big thing.
And Jimmy, I'll add to that the education that we're doing also, we're expanding now to pediatricians. So my pediatric nurse practitioners, pediatricians who are looking and caring for adolescent and
Mhm.
young adults, they are ones that we're really focusing on now regarding HIV screening and PrEP. And you asked the question before about PEP, very
Yes.
important actually. So if someone feels that they have been exposed for whatever reason, sexual assault, there is something called PEP,
Yeah,
post-exposure
sure.
prophylaxis. So that is medication that's taken for 28 days. It actually works. It prevents
Hmm.
someone from becoming
Hmm.
HIV infected. And then we, with doing a history and discussing this with this person, are they a candidate for PrEP? So whatever happened, is there a possible risk going forward? Can we talk about PrEP? So we transition them right from PEP, post-exposure, right to pre-exposure.
It is amazing to I'm doing a couple of things here trying to make sure that I'm trying to put links in the comments because we want to make sure that people have the resources to look. So I'm going to continue to work on that, and even if I have to do it after the show, I'll put those links up.
Hmm.
But resources are available. One of the number one resources that is very easy for you. It's 24 hours a day, 7 days a week throughout 3 locations here in the city of Boston are the ABCD sponsored 24/7 free confidential kiosks that are located. And I've been trying to do this at 110 Claiborne Street in Dorchester, 56575 Warren Street at the Thelma Burns building, and then at 474 Parker. I'm going to look in the back there. But that is one of the kind of confidential, if you don't want to go into a provider, we always encourage you to go into a provider, but that's a resource as the kiosk. ABCD has a whole family planning, sexual education component. And what are some of the other resources? Kim, and then Deb will come to you. What are some of the other resources that are available?
And people laugh at me when I say this. Talk with your friends. Because as I always say, we all know somebody who's HIV positive, or we know somebody who can help us. You know what I mean? Communicating with your friends. I mean, I'll never forget. Recently, I had some lady out of the clear blue sky say about we now know she has a sexually transmitted disease, and she was like, talking to me, and I'm like, hey, you know what? I know some places I can go with you. You know what I mean? I can direct you to people who can help you. Talk to your community. As I always say, each one of us knows somebody who's affected with HIV.
Whether
Or
we
doesn't.
know it or not, whether
Yeah,
we know
yeah.
it or not.
You might not
Right,
know it. I mean,
right.
I've been in environments, and I've said my story, and I've known the people, and I had these people walking up to me, and I'll never forget the first time it happened. I'm looking at this lady who I've known for 20 some years, going, "Oh, okay." You know what I mean? And she wanted me to teach her children about condoms. You know what I mean? Just talking to people in our community, because you never know who can direct you and who's willing to go with you. Because we have health centers. You know what I mean? You can just walk into a health center, even if you're a teen over, I'm not sure exactly the age, and they will help you. You know what I mean? And it's not the fact that you have to worry about your parents knowing. Yes, they're going to talk to you and guide you, and yeah, eventually you will have to talk to your parents, but there is agencies out there. We have community. I always say we got community health centers on every other street around here. You know,
Accepting
just
love's
walk in
very-
there and talk to somebody. You might walk in there and run into somebody you know, or you might just walk in there and I always say the best places to walk in is places you don't know anybody. Because when you walk out, you've met somebody.
And to that piece about knowing and not knowing someone, there's still unfortunately a stigma,
Yeah.
with this. And then if you are seeking maybe for STI or unplanned pregnancy,
Mm-hmm.
that is still there as well. And so Kim, when you mentioned around health centers around every quarter, I'm going back, thinking about places like Roxcomp, back in the day,
Whittier
uh,
Street.
Whittier Street, Demick. There's
Demick.
a
Yep.
whole bunch of
Mhm.
community health centers in the Boston area. And if you go into one of the local, I used to call them APACs. Oh, Jesus. One of the ABCD family resource centers throughout the city, someone there can also connect you either to health services at ABCD, or I'm sure they have referrals that I'm sure they have information that they can pass to you to go see a provider. Deb, as we get ready to wrap up, Kim did mention that age piece, and I think it's important for our young people as well as parents to know, as a provider, what are you at what age are you in autonomy with a patient where you don't necessarily have to discuss the healthcare with the parent? I just want to have that age number so parents and the young people know as well.
Well, it depends certainly on the maturity. I mean, we now are encouraging, and our pediatricians and nurse
Mhm.
practitioners are, the examination for a young child, 11, 12, 13, whatever age. Part of that visit is with the parent in the room,
Yep.
and then the provider is saying, I'm going to speak to Robert, alone, and we can come back at another time to be able to have that one-on-one conversation with that
Mhm.
young adult, young adolescent, because PrEP is available for anyone. There's a certain weight limit, but as young as 13 years old, 14 years old,
Mhm.
if in fact there are risk behaviors going on. So yeah, we pediatricians are very good with their population. PrEP is something new for them, so that's why we're doing a lot of education and focus, saying, look, this is something that could help prevent HIV from your patients. So we're just working a lot with them. One resource I would add, Jimmy, for you
Please.
also,
Yeah.
please make sure that people know, again, Kim mentioned this, the PrEP medication. We have PrEP DAP, the PrEP
Mhm.
Drug Assistance Program.
Yep.
We have PEP also, the Post-Exposure Prophylaxis Drug Assistance Program, through Community Resource Initiative. So there should be no question as far as coverage is concerned, because they will find a way to make sure that that patient gets the medication. So that's an excellent resource for your viewers.
I am in the process of course, tech always doesn't want to work with me. I am, folks, putting comments. If you're watching on Java with Jimmy, in the comments are active, hyperlinked links to resources on the James Hills page. I was trying to do it and it's not working with me. And so there are a few here with AIDS, SVU, also Fenway Health Center,
Yes.
here in the city of Boston. And Deb or Kim, anything that you guys would like to get to me as far as information or follow up, I'll be glad to post that.
Wonderful.
Mhm.
And I'm putting more
Mhm.
information out here as we speak. And I think I got most of the links that will work with me here, but I'll put more up as we get them. But I really appreciate both of you coming in and having this from a clinical standpoint, and also a real life standpoint. And the real life is for both of you, as a provider and also consumer, Kim. But this is something that is very important, and even though we don't talk about it as much in maybe in schools and with our young people, like
But
we used
schools are not really even talking about it that much. I'm on a big campaign with another one of my organizations. Schools are not talking about that much. That's what I think one of the barriers are.
so
They
to
think
Deb's
that
point, yes,
yeah,
about working with the pediatricians
yeah,
and starting it.
yeah,
Yeah,
because
yeah.
schools are not. I mean, to get into a school nowadays is like pulling teeth. I mean, at one time, a group of us were all trained. We went into schools, and as time goes by, there's less schools, less schools. We're trying to get into different schools to teach. And I will say that I've met some of the students that I've spoken to, now college students, who thanked me, who say to me, "Wow, thank you." I'll never forget the one girl who came to me. She actually came to Fenway Health. I did an event there, and she goes, "Thank you." She goes, "You don't understand. You have spoken to me and my two brothers." And I brought my brother, and I looked at the young man and said, "You look familiar." And he goes, "Thank you. Really, thank you. We learned so much by you coming in our class and being real, just sitting there with us, chit-chatting and answering us questions. And I have a little game I play with the kids, and she's like, "I'll never forget that game you played." And I'm laughing because I'm like, it's something I made up one day in a room full of kids, but I didn't have anything to do, say to them. But no, it's not being as talked about as so much. It's like another health thing, like, diabetes. You got diabetes. Okay, this is what it is. Move on. You got this is about HIV. You move on. And we're not giving the impact as we did in the past. And we should.
I know one of the ways that at least I believe, I don't want to get the number wrong, but ABCD with the Boston Public Health Commission does have a partnership for school-based health centers. It's not in every school.
Nope.
But where ABCD and the Health Commission does have a partnership, this information is readily available. And I think, Kim, to your point, that, students will tell other students, "Yo, I went to the clinic," and they, so even, we ideally would want this available in every school, but at least through the partnership that ABCD has with the Health Commission, there are, I believe, 13 schools, and you can go to the ABCD website. I will put that in because I have to go and pull our cuffing season link about that. But I just really, this is important information. And again, I think at some point we'll need to do maybe an after dark, or even bring in a couple of brothers and have a real conversation about prevention, about treatment, and also having, like, it's a skill to be able to sit and have a conversation with a partner about your sexual history.
I will be the first to say that. I will be the first to say that.
Your sexual desires and things like that. So,
because it's easier not to say anything and just go about your life and just play like it's stupid. It's much easier, but to have the conversation.
Kim, I want to especially, Deb, thank you for the 40 years of work in this space as a clinician. You sense the passion, you sense the full awareness, the sense of equity, no matter race, creed, sexual preference, or whatever, that exudes out of you. So
no, she's a good woman. She's a good woman.
And Jimmy, thank you for what you're doing. You need to do this more because we need you. We really do need you. We need your voice. We need your programs.
Yes, ma'am. And I can't do this type of space without that partnership and support and the plug we have with Maureen there, to pull clinicians in and partners like you, Kim. So we're going to do more because it is, you all know this from the work. I'll frame it like this. As individuals and society deals with just lifing, for whatever reason, people make decisions, people are seeking distractions from life, people are seeking whatever. And as you said, we're going to need these conversations, and I think we're going to need them a little bit more in the near future. And I'll just leave it like that. So Lee and Jamie don't get me in trouble. All right. So I'm going to let you both go, but thank you.
Thank you, Kim.
Thank you. Thank you.
Thank you.
Your work is good, Jimmy. Getting that word out.
Thank you, Kim. I appreciate it. And coming from you and Deb too, but Kim, you got a little reputation in community, and you don't hold back, and you don't, falsify stuff. So I appreciate
I just tell people, what, it's you got to be real. Got to be real. This is a real disease, and it's real to people's lives. You know what I mean? Yes, and education is I always like, I actually go to seminars that Deb's organization goes to, so I can be informed. And I've actually sent them to friends of mine saying, "Hey, just sign up. This is good. This is going to be good." You know what I mean? Because education is, Debbie said, educating our population is the main thing. I always tell people, I can say it to you 50 times, 51st time you might click, but I'm going to say it to you. I'm going to educate you in it.
And we didn't articulate these words, but along with abstinence being a number one, education is like number 1.1 when it comes to prevention. So listen, it's 11:06. I did. But it is just so important, and just, the engagement information exchange here is key. So I didn't mean to hold you guys that long. Thank you all so much. Deb, I hope you're not having a patient waiting.
No, I'm fine. Thank you.
All right.
Thank you so much.
So much.
Take care.
Thank you.
Thank you.
Bye.
listen, everyone, I think it is paramount. Not I think it is paramount that you share this information. If something that was said today sparks something in you about yourself and or a loved one, a niece, a auntie, a uncle, reach out. I need to get the link for. How don't I not have my phone with me? What was it? Cuffing season. The link will take you to all the services. Let me see if I can get it. I can't remember it. Oh shoot! It wants me to sign in to Bitly. I'll put it on Java with Jimmy, or if anyone, Dina, some of my folks in here. And here is Maureen. Maureen, thank you, thank you, thank you, thank you, and all the folks there at ABCD, because yeah, this took me back to my health educator days. And so in this vein, I wanted to share some information with you all with additional work that is being done in this space. And so please pay attention to this brief commercial, and we'll be back with you in just a couple of seconds.
Know Better, Live Better is a community-centered campaign connecting people of color to HIV prevention, testing, treatment, and sexual health care without judgment and without pressure, right here in our community. And there are many other sites ready to support you too, because care should meet you where you are, and knowledge should feel empowering.
Visit lesbegayurbanfoundation.org/live better to see all care sites and get connected.
So you can go get information there for that. And I'll put the cuffing season link up shortly. Please plan to be with us tomorrow. Union Capital members, you all get an hour and a half today. I did not know it was 11 o'clock. Tomorrow, continuing in the vein of healthcare, from a mental health standpoint, we have the opportunity to speak with the state's Office of Behavioral Health and Prevention, Office of Behavioral Health Prevention and Promotion. And so Dr. Fumi is going to be with us, and we're going to talk about the state's efforts to make sure that we continue to demystify the importance of maintaining our mental wellness and also addressing our mental illnesses. And so please plan to be with us tomorrow at 10 a.m. And then on Thursday at 10 a.m., we're speaking with Rasan Hall, who is the CEO and president of the Urban League of Eastern Massachusetts. So that's our programming. Also on Thursday at 6:30 p.m., the program actually starts at 6, but 6:30 p.m., I will be the guest with Brother David Halpert on Talking Neighborhoods on the Boston Neighborhood Network. And also at 8 p.m., I am speaking with a Black clinician around liberation, Black history, how we continue to make history from a standpoint of clinical Black liberation. You all don't want to miss that on Thursday night. So thank you all for being here today. And we will see. Oh, I didn't even go to Instagram. Sorry, Instagram folks. Oh, goodness. I had questions over here. I am so sorry for the folks that were on Instagram. I opened up my notes and didn't see it, but we got Charlotte. I saw your question. Maureen, if you could let me know, there was a question here, and I would love to connect you with Charlotte because she's the healthcare person at Greater Love Tabernacle. And Dina had, oh God, when I have guests like that, sometimes I don't pay attention to all the questions, and I should. Charlotte said, are we still looking for vaccine to mitigate HIV infections? At this point, we should have something. They are on the road. I've seen some things on social media, legitimate social media, pointing to research being done. So we'll try to do better at paying attention to questions. And thank you all again for being here. I'm really going to really make sure you get connected. Charlotte, I got you. Shoot me an email and I'll forward it to Maureen and then get y'all connected. Because, once I hit end, that 54-year-old brain, no, I'm good. Thank you all for being here, and we'll see you tomorrow morning at 10 a.m.